Okay, hello, my name is Mark Hammond Baker. I live in Brandon, Mississippi, and I am a person with schizophrenia. I'm making this video today because I want to encourage everybody with schizophrenia or any kind of um, mental diagnosis to take their medication. Um, I didn't go to the pharmacy for a few days to pick up my medication, and of course, this is for my concentration medicine. My primary medicine I get uh, as an injection once a month, which I highly recommend. I take the Aristata, which is Abilify, but I've also been on the Invega shot. But taking the shot is so much easier because you don't have to remember to take your medication every day. They give you a shot once a month or once every 3 months, and you don't have to remember to take your medication at all. Well, that's for the antipsychotic. I didn't take my medication, my concentration medication, for about 3 days, and I could just tell that I wasn't focused and I wasn't thinking like I normally do, and I was unmotivated, um, um, and I'll go ahead and say this while I'm at it, that it's really important to have a good relationship with your doctor, um, because your doctor does want you to feel good. And some of the side effects of the medication do, like especially with the concentration medicine. I don't know what you're on, but I'm on armodafinil, and I feel more motivated, more confident, and it makes me feel good when I take it. And I think my doctor is on the same side when it comes to me feeling good and thinking clearly. But back to what I was saying, I was off of that meds, and I could just tell a big difference. And because sometimes I think, well, I've gotten this far in my life, I've studied my whole life, I've gotten through college, and I have a job. Maybe it's time I don't need this medicine anymore. Well, I know that's not true. I take two medicines. I take the Aristata for which is an antipsychotic, the Abilify, and I take armodafinil for to help me stay awake and uh, for my fatigue and help me concentrate. I'm very fatigued and unfocused when I don't take my armodafinil, and I could tell that without it, uh, there was a big difference. And like with most drugs, you have to take it as prescribed. It took me a very long time. I was once on Vyvanse and overtaking that. This was 10 years ago, but when I was overtaking that, it was the amphetamines before I was diagnosed with schizophrenia was making me more psychotic. So eventually, my doctor, when I moved to Mississippi, he told me, Mark, you don't need to be on the Vyvanse or any kind of amphetamines. You have schizophrenia. That's your diagnosis, and we're going to have to take you off of that. And of course, I was a little upset about that because that was what was giving me energy and helping me focus, and it was a very rewarding medication. And it did help me get through college, but it also caused a lot of problems because I wasn't taking it correctly. And so I think both medication compliance, being on the correct medication, having a healthy relationship with your doctor, and taking your medication as you're supposed to are very, very important, especially when you have schizophrenia. For me, I work in a professional environment, and people always wonder about what medicine I'm on, but I find out a lot of times the people who want to know are also on medication themselves. And I'm not giving out any names or targeting anyone in specific. I'm just saying a lot of people and almost everyone is on some kind of medication. So you should never feel ashamed for taking medication. Um, and antipsychotics are very uncomfortable to take at first until you find the right one. I remember when I first started off on Zyprexa, I couldn't stand it because Zyprexa makes me so tired. But I was so psychotic and out of control that the doctors really didn't have a choice. I kind of understand the decisions the doctors were making for me when I wasn't in my right mind now, because and the primary reason that I had to be on such a high dose of a medication that made me so sleepy was because I was abusing the amphetamines, the Vyvanse. Um, so it is a journey to get stable, and but being stable is so much better than being unstable. I can tell you that. Being able to concentrate, and you really have to work out with your doctor. You have to do research, and sometimes your doctor will tell you what medicine that he wants you to be on, and but at the same time, sometimes there's room for negotiation, and you can ask. Um, you can look up, you can do some research and find medicines that you think you might want to try, and ask your doctor about it. That's always an option. But I just really want to encourage anybody who has schizophrenia to be compliant with their medication, even though uh, it can be really hard at times, especially when you're transitioning from being psychotic to being stable. That transition can be very uncomfortable because we're not manic, but we're practically, we have the energy of someone who's manic, and we're not thinking clearly, and we're putting ideas together that don't make sense, and so on and so forth. I've been through it all. I've been persecuted. I've had delusions. I've heard voices. I've hallucinated. Um, I've been through it all. I've been through a family abuse, trauma. Um, and I also encourage everyone to talk to their therapist about these things. Um, I'm not a professional therapist. I'm just someone who has schizophrenia, who is putting a word of advice out there that I hope everybody stays on their medication and takes it like they're supposed to, because when you run out or you forget to go to the pharmacy, or it just that's one reason why I'm on the injection of the Aristata, so I don't have to remember to take my antipsychotics. And that's really an advantage for people with schizophrenia, because all the other medicines aren't as important as our antipsychotics, if you ask me. So the injection is very, very useful. But if you want to take oral tablets or capsules, that's fine too. Just remember to take your medication, because uh, it does help. For a long time, I didn't think taking medicine was worth it. I didn't think it would help me. I thought it was dumb. But as time went on, I realized that the relationships I have with people are very important. And being able to sit down and talk to somebody is a lot easier done when you're stable on your medicine. So someone doesn't have to take care of you, but you can actually engage with them and learn and be productive in society. So that's all I'm going to say for today. I hope you all have a great day. God bless, and feel free to contact me again. My name is Mark Baker. I live in Brandon, Mississippi, and if y'all ever want to message me about anything going on with schizophrenia, I know there's a couple groups on Facebook and Instagram that talk about schizophrenia, and I'm just one of those people who have schizophrenia, and I'm just getting the word out there that people with schizophrenia can manage their symptoms and exist, and with any kind of point of view or perspective that they want to have. But medication or no medication, we're still people who have value. And we're not schizophrenics, but we are people with schizophrenia, because I want to emphasize that we are people, just like anyone else. Okay, so have a great day. Thanks.